I'm delighted that the target was met concerning the tests, and the military was involved in that, as is the military been involved in getting the PPE where it's required, as was the military involved in some instances, throwing up hospitals in the matter of days. Perhaps a word on what those men and women have achieved on behalf of all of us. Good morning, Mr. Secretary.
Good morning, Nick. Look, I think they've done an amazing job. When required, we've got the backs of the UK and the NHS and everybody else. And quite early on, we put in over 1,000 people in the command and control and the logistics part of both the NHS and the wider public sector. And we knew that the testing target was high and demanding. And, Matt Hancock and I had a discussion, and we put out 92 mobile units, which are out today. We start from the process of making sure we've got to take demand to people. The regional sites were fine, but the reality is if you're working a hard shift in a hospital locally or in a care home, the idea at the end of the day, you're going to get in your car if you're not feeling very well and drive an hour, just wasn't going to make sure demand got to testing. So let's take the testing to demand. And the Royal Engineers set about it. They designed a process, they tested it, and we trained over 1,000 troops, and now they are deployed from Elgin in the north of Scotland all the way to Bromley. So they're all over the place, hopefully delivering testing as required.
Yes, it's a great job. Do you concur, though, with your cabinet colleague, Grant Shapps, when he said if they'd got more tests, if you and the government had been able to get more tests, fewer lives would have been lost?
Well, I think what we know, and as you know, having commentated on this outbreak for many days now, is let's remember at the beginning of this, the problem with testing was not the people, it was the shortage of reagents. And I was involved in ringing around my counterparts in Europe, asking if they had reagents, and they too didn't have the testing reagents. So it wasn't as simple, unless your country already had its health service designed to be diagnostic front heavy, like Germany was, to pop up the testing immediately. Of course, testing globally would have improved all of our chances with understanding this virus, because part of the epidemiology is informed by knowing who's got it and how they respond. And I think that has been a challenge. It came from the other side of the world, and all of us have been learning on the job. And I think if we'd known from the outset more about the virus, of course more lives could have been saved. But I don't think it's a country-by-country problem. I think it is a massive problem around how we share intelligence on viruses and learning at pace.
There are reports that some parts of the country, some people really are experiencing lockdown fatigue. Is it really necessary? We have to wait virtually an entire week before we hear from the Prime Minister next Sunday?
Well, I think we'd always declared when we extended the 3-week lockdown, the 7th of May was going to be one of our main decision points. What is this week going to happen is predominantly two things. All that testing that's been in place, plus a specific testing regime called, under the ONS, the Office of National Statistics, will feed into a scientific discussion about whether we are confident the figures are in the right direction and permanently or are staying in the right direction. And then have this week the discussion about what our tolerance levels are and how we then lift the lockdown. So, the Prime Minister will, at the end of this week, I think, explain the details of where we've got to. But, Nick, I'm as impatient as you are. I got coronavirus a few weeks ago, and I sat in my flat in London looking at the wall for 8 days. And I understand the real challenges for many people. And I am desperate to go out and, socialise, meet people and get back to normal. But I also am desperate to preserve the capacity of the NHS and indeed, protect the lives of those people. Because otherwise you'll ask me the same question you've just asked about if you'd waited another week for lockdown, could more lives have been saved? I don't want to be sitting on an interview with you having to answer that question if we get it wrong. So I think it is right we wait. We get informed by detailed testing analysis and science, and then we'll be ready to get it right.
Is it fair to say, Secretary of State, cabinet meetings will never be the same again because you're going to have 6'6" between the two of you? And I recall mentally pictures of you, and you're as if you're in a school dining hall. You're sat shoulder to shoulder.
Well, there might be quite a benefit.
Well, I agree. It depends who you sit next. It depends who you sit next to, Secretary of State. I'll have to check the picture.
Might be some people I don't want to sit next to. Look. Hopefully, this coronavirus is not forever. I mean, we have to get through it.
But going back to work, we read government requirements could be that I need to be 6'6", 2 metres away from my colleagues, which is going to be, in some instances, jolly hard to enforce.
Well, we already see people adapting to that. I mean, when you go to the supermarket, for example, you queue up and you're not 2 metres away from the person working on the counter and the till.
No.
Because they have a shielding in front of them. So there are methods. You could have PPE, you could have shielding. You could not spend so much time next to each other because, the distance is as much about the probability of catching something, and the longer you're standing next to someone, the more likely you get it. So you can think about timing. You can also think about people who've already got it. I mean, if you've had coronavirus, are you a White Walker? Are you from the? Are you a sort of able to mix more than others? I mean, that's the sort of line that people are trying to explore when it comes to how immune are you? I mean, that is a key question, and that's why this testing is going to be really important.
There are concerns over how the future of the relationship between the United Kingdom and China should be as and when the world emerges from this. Do you think China has questions to answer about how speedily it made the world aware of the extent of the crisis?
I think it does, but I think the time for the sort of post-mortem on this is after we've all got it under control and have come through it and our economies are back to normal. And I think, that it's in everybody's interest for us to be transparent, both here and abroad, so we can collectively learn from this outbreak so it never happens. I think that is the really important test for us all. And, only by being open and transparent will we learn about it. And China, needs to be open and transparent about what it learned and its shortcomings, but also its successes.
And when we hear more on these, and I appreciate these are very fluid and conversations will go on between you and other senior members and the Prime Minister through this week, but there's a suggestion that people over 70 might be required to stay in even after the first wave. How fair is that? That means Richard has to go out without Judy.
Well, look,
and have you thought of the implications of that?
I'm not going to... It's not a laughing matter.
It's not a laughing matter. But if you are in a relationship like that, a husband can go out, but he can't take his wife, which seems a bit strange.
Look. The reality is, the NHS publishes some quite clear advice about over 70s. It classifies them as either two groups of people, either very highly clinically vulnerable if they have other conditions, in which case they have to take extra precautions, or highly vulnerable, in which case they have to regard, some more measures, but it is not a blanket effect of the over 70s. I think that's the real challenge, Nick, to make sure. But look, you're right. My parents are in their 80s. I mean, the idea that they're going to, knuckle down and find that they have to get treated differently is a challenge, and we're going to have to make sure we do everything to protect them. The best thing we can do for them is get a good testing regime, which I think we now have, and hospital capacity should anything go wrong.
Lastly, can't let you go without a word, and what you say now will probably play out again on Friday. You know the relevance of Friday's dates. You have the privilege of being Defence Secretary now. You go back to those times 75 years ago. A word on the success of the British Armed Forces.
Well, the Armed Forces have done an amazing job. Just like 75 years ago, they have stood up, they have facilitated, enabled and delivered, not put themselves first, put others first, like our NHS workers, and delivered to keep us safe. They'll continue to do it. And the spirit of Tom Moore is the spirit that we're seeing today as well. And, on VE Day, on Friday, let's remember we have the freedoms and we have an NHS, we have all these things because of the sacrifice made by those soldiers 75 years ago.